So this is a video on how to do at first an APGAR score on a newborn, and then how to do a physical assessment on an infant. So first thing for the APGAR score, we would first look at this would be done in 1 minute and then at 5 minute intervals. If it's lower than 7, we're going to redo it again every 5 minutes until we get a higher score of 7. And if it's even lower, if we're looking at like a say 4 or something low like that, then most likely the baby is going to be either intubated and taken to NICU or such. So for an APGAR score, we're going to look at the heart rate first. 0 would be absent, 1 would be if it's below 100, and a 2 would be given if it's above 100. Respiratory effort, is it absent, is it slow, is it regular, or do we get like good crying, like if we stimulate the baby, is the baby crying? Also, we're going to look at muscle tone. Is it limp? Is there a little bit of flexion? Are they actively moving? So that would be a 2 for active moving. Reflexes, we're going to look if there's no response. That would be a 0. If they're grimacing a little bit, maybe frowning, that would be a 1. If they cough or sneeze, then you would get a 2. Also, you have color. Yeah, are they blue completely? Are they just like a pale? Is their center blue, but their extremity, or I'm sorry, their center's pink, but their extremities are blue, or are they completely pink? So that would obviously be done in 1 and 5 minute intervals. Another thing that we can also do are the reflexes. Now, the reflexes, there's a couple of reflexes. The first one would be the rooting, where you rub the cheek, and then the baby will actually turn towards the stimuli. Okay, usually that's going to be gone in about 3-4 months. It'll disappear. If it keeps going, most likely we got some type of neurological condition. Also, you can, with a gloved finger, you can see if the baby would suck. That's another reflex. If it persists past a couple months, then, or up to a year or so, then I look at that. Then you got the Moro or the startle reflex. So you would hold the baby and then kind of drop them a little bit, let them feel like a couple inches, nothing too much, and then you should see them fan out. If they fan out and extend their legs, that's a good sign. That's a positive. That's good. It is very strong at 2 months, gone around 6 months. Then you've got the trunk or the Gallant's incurvation. So you would have the baby as such, and then you would stroke one side, and then the baby would turn their hips and their trunk towards that side. So if you did this side, you would turn. Okay. Then you've got the palmar grasp. So if you put your finger right here, then they would actually grasp, and that's a good thing. It's usually strongest around 1 to 2 months, and if it's present at the 3rd month, you might want to see some type of neurologic condition. Then you got stepping. So you put the baby and you'd have them kind of touch lightly on a flat surface, and then you'd see them walk. And that would be a positive thing. See them kind of step. And that's usually for the first 4 to 8 weeks of life. If it persists, you might want to look for cerebral palsy. Then you got the Babinski. So you would take their foot and you would rub like on one side of the foot or the other, and then their toes should fan out, and then the big toe would curl towards the top of the foot. And excuse me. And again, that is a good thing if it does that. So that would be the reflexes. If we're going to go into then for the assessments, you could look at vital signs. Vital signs, normally we don't take like blood pressure. If you actually do, make sure that it fits on all 4. You got to take them on all 4. Okay. For a normal systolic, roughly it's going to be 50 to 70 for a newborn, 70 to 100 for any infant that's older than a month. You're also going to look at the heart rate. The heart rate should be 110 to 160 for infants. For newborns, and then for infants older than a month, it will be about 80 to 140. Respiratory rate is going to be 30 to 60, and newborns would be I'm sorry, infants would be 22 to 35. That'd be respiratory rate. So pain, obviously, we've done pain assessments. We're going to look at the baby. If the baby is uncomfortable, moves around a lot, very irritable, most likely the baby's in pain. If not, then the baby's comfortable, is easily consolable, the baby's not in pain. We're going to go into the measurements. One thing about the measurements is if the baby was born prematurely, like for example, if they were born at 30 weeks, then we would, I'm sorry. Oh, if they were born at 30 weeks, then we would go ahead and minus that from 40 weeks, because all the curves are done with someone that is born at full term. So whenever we would do the measurements, whenever we would look at the charts, we would have to do the adjusted or corrected age, where we would have to take whatever weeks they are, and then minus that from how early they were born. So we would do measurements. What we could do is we could lay the baby down, extend their legs one way. We could draw like with a pen. You can draw on the table, so that when they start flexing, that's okay. And then you just measure from the top of the head, and then you measure it. Then you measure it all the way to that mark. And that will be the height of the baby, and it should fall between the 10th and 90th percentile. You will also do the head circumference. Measure the head circumference with the tape, and then you do the chest circumference. So you just measure it all the way around. Nutrition, you look at their skin, make sure it's supple, it's soft, make sure their hair is shiny. They should be consuming anywhere between about 100 kilocalories every day per kilo. So usually a formula contains about 20 kilocalories per ounce, so we would go ahead and obviously educate the parent on that. We would also see if they're wetting 4 to 6 diapers. That's telling us that the baby is being well nourished or well hydrated, and make sure that they have regular BMs and bowel movements, and that they're soft and not watery. Mental status, really all you can do is just look at that they're appropriate for their ever stage they're in. So as they get older, you'll be able to assess to see if there's any kind of neurological deficit or anything of that nature. Make sure that when you make a sound that they turn their head towards the sound. Make sure that they can track with their eyes as they get older. They may even reach for things, and they should be able to be rocked in the arms or on the shoulder, and that would be able to calm them down also. Violence, you can obviously look at the baby physically, make sure there's no bruises, unexplained fractures, any of that nature. If the parents are kind of giving you, like inconsistent stories, if they're kind of doctor shopping, then those are things that we would want to take into consideration for violence against the baby. Also, you have skin, hair, nails. So again, skin, make sure it's soft, make sure it's not excessively dry, make sure it snaps back when you do the skin turgor. Make sure there's no rashes, any lesions, bruising, any kind of edema or any of that nature. Make sure that the hair is soft and shiny. Make sure that there's the nails are secure and they're good to go. They're not coming off. Make sure that they're pink, except with dark-skinned people. You'd probably be more like pale, white. Also, there's normal variants. You'll have the Mongolian spots. Okay, you have macular stains, which can usually appear here in other areas. Then you'll have spider nevus, which is almost like it's a benign little bump. It's like a little where the arterial kind of collected, and then you've got a bunch of little like veins coming off of it. And that's all benign. Then you would look at the head and neck, make sure that the head is sized, the shape, make sure it's symmetric. Make sure you palpate the anterior and the posterior fontanelles and the sutures. You trace them. As such. Ensure that they're not fused permanently yet. That would be a problem. Posterior should be palpable. It's about 3 months. Anterior usually closed around 9 to 18 months, and it's flat, not sunken or bulging. And usually you can touch it, and you can actually feel the heart rate coincides with the heart rate of the baby. Also check range of motion, make sure that you can turn their head side to side, side to side like this. Make sure they can go back and forth, so they have a full range of motion of their head. You would also look at the trachea, make sure that it's midline, make sure that there's no lesions, no swelling, any kind of things going on there. Make sure that the clavicles are smooth. There's no pain, no tenderness, lymph nodes. So you're gonna look at all the lymph nodes, make sure that they're nice and. You may be able to palpate them, but they should be mobile and they're non-tender. Eyes, make sure that they're symmetrical. Make sure that the lids are proper placement. Make sure that the sclera is clear and white. The light reflex pupils are equal and reactive. Assess for the red reflex. So you would get like the light of the optometric and look on the side until you can adjust it until you see a red glare. If you do not, you've got a problem. Newborns are usually sensitive to light, so they might close their eyes, and they might keep them closed for a long period of time. And then older infants will kind of follow objects. Ears, again, make sure that the placement is correct. Make sure that they're symmetrical. Make sure the line, the pinna line, is above the imaginary line from the inner canthus of the eye through the outer canthus and continuously past the ear. So make sure that that's high. If it's low, it could be a sign of possible Downs. The otoscope visualizes the tympanic membrane. Check for the eardrum. You can also get a little bulb. You can shoot a little bit of air in there, puff a little bit of air, and then you can see it respond by moving. Then you're going to look at the nose and the throat, mouth. You're going to make sure that the nose is midline and the face is symmetrical. I'm sorry, it's symmetrical to the nose, to the face, and the nares are symmetrical, they're even, that they're painting bilaterally. The uvula, you can look inside. While they're crying, you can just look in there, make sure that it's there, make sure it's moist, make sure all the mucosa is also pink and moist, make sure the tongue is the right size. You can look at the lips, make sure it's symmetrical. Upper lip may have like a little blister, and that's just benign. It's just like a sucking blister, and it's usually a little like a whitish nodule. Then you can look at the throat and the thorax and the lungs. So here we're going to look at their breathing. You're going to see that their abdomen is going to be moving. Make sure it's symmetrical. Make sure that the chest expands bilaterally. And we're going to auscultate. Then we'll auscultate all lobes, front, back, and also side. Okay. Their inspiration is usually a little bit longer than expiration, and that's normal. Make sure that the capillary refill is less than 3 seconds. They may have circumoral cyanosis. That is normal as long as the lips and tongue remain pink while they're crying. Then the heart and neck vessels, we're going to auscultate and inspect them. So we'll listen to the heart, check that apical pulse. You can, if you can, listen to the neck area. Shouldn't be any bruits. Oops. Then we're going to look at the peripheral vascular system. So we're going to feel the pulses, make sure that they're good to go, and that's going to be bilaterally. And the same thing with the feet. Oops. Then you're going to look at the breasts and the areolas, make sure that they're full, make sure that the nipple is there, make sure it's well formed. If there is it's normal for male and female to have swollen breasts and to have some type of watery discharge. That's normal. The hormones are causing this from the leftovers, and that's normal. The abdomen, make sure that it's cylindrical. It protrudes out slightly, which is normal. Moves in synchronous with the diaphragm. Umbilical area is clean. There's no drainage. You will also auscultate the bowel sounds. And same thing. So just like an adult. Okay. And then you're gonna palpate So you'll palpate. Since it's a baby, you don't really have to palpate very hard. You gotta percuss. Okay. It should be soft. There should be no rigidity. It should be tender. No hernias present. Also go to the musculoskeletal system. Well, by now you've already seen the baby moving around. You can just make sure that the ankles are good, that they got good range of motion. Make sure the arms got good range of motion. Make sure that the hips. So what we do for the hips is you've got the. So for the hips, you've got two moves that you would do. You got the Barlow's and then the Ortolini's maneuver. You have to do it in order. Barlow's is first, so you would bend the knees towards the chest, as such, and then the Ortolini's is you're kind of moving it outwards. Okay, and just making sure that the hips are good. Also, we're going to look at then the neurological. So by now, again, you've seen the baby, how it responds to light, how it responds to stimuli. Make sure that they do get kind of startled when there's a loud noise. Make sure you palpate the spine. Make sure there's no dips or tufts of hair in the spine, and then make sure it's midline. Okay, genitalia for the female, usually the labia majora cover the vestibule, enlarged clitoris and labia. Those are normal too. A few drops of blood in the diaper maybe notices. That's normal. Clean and free of foul odors. Also, for the male, the penis, make sure it's clean. Make sure the placement of the urethra is, of the urethral meatus is on top and in the midline. Also, the scrotum, make sure that the size and color and it's symmetrical, descends bilaterally, free of edema, masses, or lesions. And then the anus and the rectum, make sure that you palpate with the little gloved finger. Okay. Make sure that there's no lesions, there's no bleeding or anything of that nature. Make sure there's no and make sure that when you do put a little bit of pressure, that it contracts. So that is a infant assessment from the moment they're born and until they get to a little bit old. Thank you.